Hello, and thank you for joining us today on That PSA Show. I'm your host, Jerron Bork. May is American Stroke Awareness Month, and stroke is the fifth leading cause of death and a leading cause of long-term disability. But there are some precautions a person can take and some warning signs that a medical emergency is at hand. And here today to discuss American Stroke Awareness Month is Dr. Khurram Arif, volunteer for the American Heart Association and Chief Medical Officer for Western Health Advantage. Hello, Dr. Arif. Thank you for joining us.
Hi, Jerron.
And so strokes can happen to anyone at any age. Now, clearly, they're more prevalent in people who have gotten older, but having a stroke puts you at a higher risk for a second stroke. And knowing the warning signs can make all the difference in recovery efforts. So let's talk a little bit about the acronym FAST. That's face droop, arm weakness, slurred speech, and time to call 911.
Absolutely. So, it's stroke is one of those things where time is of the essence. And so if anybody, comes across someone having a stroke and they can get the medical help quickly, that makes a huge difference. And so this is where the letters FAST, F-A-S-T, come in. The common signs for somebody, who comes across a patient having stroke is that your face droops. And so the easy way to kind of look for that is to ask somebody to smile. And you'll see that the smile is kind of, lopsided. And so that's a sign of face drooping. If somebody's, having problems with movement, you can ask them to, if they can stand up, raise both their arms to their sides. And you'll see that one arm will kind of tend to drift down. So that's where the arm weakness comes from. Then the S is for speech difficulty. And so that's people basically slurring their speech. And you can ask a person to repeat a simple phrase like the sky is blue or A, B, C, D, E, F, G. And, you'll find that, that their speech is a little bit slurred and difficult to understand. So if a member of the public comes across someone who's having these three things, face is drooping, their arm is weak, and they can't seem to speak properly, the next thing to do is to think of T as in time, which means it's time to call 911.
And so, as we've said, time is of the essence, and if you've noticed these signs, you can get someone to treatment as quickly as possible. They have a much better recovery chance. But what are some of the consequences of not getting it taken care of in time?
Stroke is the leading cause of either long-term disability or even death. And so these are serious risk factors. But if somebody who is experiencing stroke gets medical help quickly, as rapidly as possible, you can avoid that long-term disability and the risk of death.
So someone has had a stroke, they've gotten treatment for it, they're dealing with the after effects. What kind of situation are they going to be dealing with, and how can they reduce their chances of having a second stroke? Because now it's something that they've really got to be concerned about.
Yeah, so, people who've had a previous stroke are at a higher risk for a second stroke. And of course, patients who are following their doctor's advice and taking their stroke medications, that makes a big difference. So making sure that you're not missing your medications for that is really, really important. At the same time, because the risk is there, it is very helpful to educate family members and friends on what a stroke looks like. If somebody sitting in their chair starts to have a stroke and they have family or friends close by who can quickly catch that'll help that patient, because again, they can get rapid medical help.
Now, in the off chance that someone is by themselves when this starts to occur, what can a person do to help themselves? What is something that they need to do immediately if they notice these symptoms in themselves?
They need to call 911, and this is where having your phone with you is very, very helpful, because you can use your voice activation and call 911. So that's the most important thing. The way that a patient who's having stroke experiences it, it's difficult for a patient to tell if their face is drooping or not, potentially, but certainly you can tell if you're having trouble speaking. You might start having a strange feeling. You might start feeling weak. You may feel like you can't get up or you'll fall down. And you might feel some funny sensations on the face because of the muscles being activated from the stroke. So, and I think that the important thing to just remember is that, we use the word stroke a lot in the medical profession, but For a layperson out there, the word stroke means that there is a problem going on in the brain, a problem that requires immediate medical help.
Speaking with Dr. Karam Arif, volunteer for the American Heart Association and Chief Medical Officer for Western Health Advantage. We're talking about stroke. May is Stroke Awareness Month, and stroke is the 5th leading cause of death and a leading cause of serious long-term disability. Despite stroke being largely preventable, treatable, and beatable, and counterintuitively, stroke is actually something that women need to be more concerned about than men.
Yeah, Jaron. So yes, it's interesting that women are at a very, very high risk of stroke, and certain things such as pregnancy put women in danger 3 times more likely to have a stroke as non-pregnant women, and that's because with pregnancy, some certain conditions arise such as high blood pressure, preeclampsia, diabetes, and blood clots. The risk of all of these increase during pregnancy, and as a result, they also increase the risk of stroke. Now, what's interesting is among women, African American women, Hispanic women have a high prevalence of high blood pressure compared to Caucasian women. The whole issue with stroke is that you have to be able to control your blood pressure, control your blood sugar, and and keep your cholesterol under control. And so paying attention to these factors and following your doctor's advice, taking your medications, having a healthy lifestyle is very, very important. Lifestyle habits such as avoiding smoking, vaping, limiting your alcohol intake, eating a healthy diet. Now, this is true for everybody, men and women. Having regular physical activity, getting healthy sleep, all these things are important to avoid stroke.
So diet plays a very large role in helping prevent strokes then. So are there particular foods or certain items that we should be focusing on in order to maintain our proper health?
Absolutely. Well, perhaps the question is what should we not focus on? So, the salty, spicy stuff that the snack stuff, definitely want to avoid that. Your diet should have a healthy mix of, fruits and vegetables, lean meats. Fish is great. The Mediterranean diet, if you can get a moderate amount of carbohydrates, it is important to get that as well. But avoiding fatty foods, avoiding certainly smoking, alcohol, those kinds of things, are very helpful to keeping your diet healthy and just improving your overall health. I don't know, Jaron, if you've ever had a family member with stroke. Both my grandparents actually suffered from stroke, and we took care of them when we were kids. They lived actually at home with us. And it's incredibly difficult to watch a loved one suffer from the after effects of stroke. Now, when my grandparents were that age, we just didn't have that much information, but there's a lot of information out there now about stroke. And I would direct folks to the Heart Association website, www.heart.org, which has lots of rich information about stroke.
Yes, and you can also go to stroke.org, which has lots of information there as well, which is associated with the American Heart Association. And so we talked a little bit about how women are more at risk for having a stroke, particularly when they're pregnant. But are there different symptoms in men and women when they're experiencing a stroke?
Not really. It's the same thing, the FAST, F-A-S-T, face drooping, arm weakness, speech difficulty, time to call 911.
Okay, so it's pretty much the same across the board, and if you see those symptoms, then immediately call 911 because it is treatable, and the faster you get treatment, the better the results will be on the back end of that.
Exactly. If a patient can get, quick access to the emergency room, emergency rooms around the city are primed for stroke prevention, and they can get certain medications on board very, very quickly. In fact, in addition to calling 911, one should note the time that they made that call, because from that time the clock is ticking.
So for people who have experienced a stroke, are there support groups for them? Can they get counseling or any kind of professional help?
Absolutely. So the most important thing after having experienced a stroke is to be able to get physical rehab or rehabilitation exercises. And so there are stroke groups out there for support, and then you would get access to medical care through physical therapy, through your physicians taking care of you. But yeah, I think that the value of community and and social help is incredibly important. Having a positive mindset does help recovery, and having, the relationship with community members who've had stroke and being able to join those groups is also really, really important.
Excellent. So there are support groups for that. You can get physical therapy to help you through. Are there other lifestyle changes aside from those and changing your diets?
Yeah, so, controlling blood pressure is incredibly important. So at Western Health Advantage, we're a local health plan. We have lots and lots of membership here in the Sacramento and California area. We actually supply our patients with free blood pressure monitors. Our patients who have blood pressure disease, they get free blood pressure monitors so that they can control their blood pressure. They get lifestyle advice like, avoiding salty foods, making sure people get reminders for their medications so that they don't miss their hypertension medications. And then same for, diabetes and high cholesterol are also significant risk factors with stroke. So if you are on a diabetes, care management program through your health insurance or through your doctor's office, it's very, very useful to follow that. I cannot stress enough the importance of keeping your blood sugar normal. And then high cholesterol. A lot of people around the country, men and women, suffer from high cholesterol. And in addition to having a healthy diet where you sort of focus on lean meats, avoid the fatty foods, taking medications on time is really, really important. Jerome, I don't know, you're probably too young to take a lot of medications, but I'll tell you, when you're a certain age, my age, for instance, you've got to take medications, and I make sure that, I leave my medication on my bathroom counter, so I brush my teeth, I see them, and I take my medications. Those kinds of things, those little reminders make a big difference.
Yeah, medications can make a big difference. Now, when I was growing up, I heard a lot about taking aspirin daily that can help to prevent a stroke or other heart issues. Is that something that is still advisable?
That has changed now. The guidance on aspirin has changed. So now aspirin is limited to patients who've had a previous stroke or who've had a previous heart attack. Mostly, this is why it's very, very important to have a good relationship with your doctor, to establish a relationship with your physician if you haven't seen one, or your primary care provider, because as the science changes, it's important to be on top of it. And your primary care physician, your primary care provider, is the best person to give you the best advice, customized to your own health. So at this point, aspirin generally should be taken only on medical advice.
Speaking with Dr. Karam Arif, volunteer for the American Heart Association and Chief Medical Officer for Western Health Advantage. We're talking about stroke today, and May is National Stroke Awareness Month. Strokes can happen to anyone at any age. Now, that is something that might confuse some people because strokes are typically associated with older people, and it does get more prevalent as you get older and older, but this could happen even to a young, say, healthy athlete.
Absolutely. So, stroke is related to certain risk factors, including risk factors based on your family history. Or if you have conditions that are unknown because you're young and you may not be going to the doctor a lot. Life creeps up on you sometimes. So yes, this is why it's important to educate the members of our community, our public, on FAST, F-A-S-T, which is the stroke signs, because anybody can get a stroke. Children can get a stroke. Certainly, if there's a family history of sickle cell disease, which is relatively common in the African American population, certain illnesses can predispose you to stroke.
Yes, and again, FAST, if you see that happening, you need to call 911 immediately. That's face drooping, arm weakness, and slurred speech. If you encounter that in an individual, call 911 immediately, because the faster you get them help, the better the results will be for them as they go through recovery. And thank you so much for joining us today on That PSA Show. I'm your host, Jaron Bork, and our guest today is Dr. Karam Arif, volunteer for the American Heart Association and Chief Medical Officer for Western Health Advantage. We've been discussing American Stroke Awareness Month, and stroke is the fifth leading cause and a leading cause of long-term disability, but it is preventable, and knowing the FAST signs that a medical emergency is at hand can make all the difference in recovery. Dr. Arif, thank you for joining us today. Is there anything else you'd like the listeners to know about?
Yeah, Jerome, I'd like to remind folks, so Western Health Advantage and the American Heart Association, we partner up in our local community, and we are strong supporters of the American Heart Association's Heart and Stroke Walk. We have it every year, typically in September in our beautiful community, and I'd invite people to come and join. Last year we had several thousand folks came out. And remember your loved ones, honor your loved ones, think about your family and friends, and remember FAST, and let's do what we can to help each other in our community about stroke awareness. So, Jaron, thank you so much for the time.
Absolutely, Dr. Arif, thank you for your time today. And again, if you'd like more information, stroke.org or heart.org has all the information that you need there. Thank you again.
Thank you.